we've got two levels of movement evaluation.
Mm-hmm.
The first one's a screen, and the second one's an assessment.
Yeah.
And the best way I can create that environment for you is when I do your blood pressure, Chris,
Yeah.
I can tell if you're hypertensive or not.
Mm-hmm.
But the blood pressure cuff does not tell me why you're hypertensive.
Yeah.
It does, however, categorize you in hypertension. So our first level of defense against movement dysfunction and movement dysfunction complicated with pain is our screening process. Our screening process stops the minute a movement pattern evokes pain. Let's say our functional movement screen is actually quite simple,
Mm-hmm.
and you can either have a 7-point movement screen administered by an exercise professional,
Yeah.
or, believe it or not, you can administer a self-screen
Mm-hmm.
to yourself. And if you go to YouTube and put in Gray Cook self-movement screen,
Yeah.
I'll actually demonstrate for you a self-movement screen. But my whole point is, either way, whether we see movement produces pain in a formal, professionally done screen, or you do it in a self-screen,
Yeah.
it tells us that you do have a movement-related problem, but it still doesn't diagnose the problem.
Sure.
Now, that does not mean that you can't use some sound advice and thorough exercise practices. The one thing I will tell you, whatever movement pattern produced the pain,
Mm-hmm.
do not exercise in that pattern.
Mm-hmm.
There's too many things going on. I don't know whether poor movement is causing the pain,
Mm-hmm.
or pain is causing distortion in, say, your coordination and motor control.
Yeah.
However, we will also identify movement issues that aren't complicated by pain,
Mm-hmm.
but we will all agree are significantly deficient.
Mm-hmm.
Work on your deficient patterns, not your painful patterns. Because we've got quite a bit of research now showing that when you exercise in a pattern that has pain involved,
Mm-hmm.
it distorts your ability to motor learn. And your responses to a painful pattern
Mm-hmm.
are both inconsistent and unpredictable. So all of your motor learning resources stop. They flatline in a
Yeah.
painful pattern.
Mm-hmm.
So let's say squatting hurts your back,
Yeah.
but we find that when you lay on your back and say just do a leg raise, you're unbelievably restricted, but it doesn't hurt.
Mm-hmm.
I would say work on that pattern and avoid the squatting pattern. An even higher level way to really attack this in an aggressive manner
Mm-hmm.
is coordinate your efforts with a medical professional and get the situation diagnosed. It does not mean you need to stop training. What it means is if we diagnose the source of back pain
Mm-hmm.
through radiological findings, we can find out if this is largely a joint degeneration issue, if this is a neural irritation issue, if this is something that can be managed with aggressive soft tissue.
Mm-hmm.
So there's always an advantage by getting a diagnosis. And I think the reason a lot of people aren't willing to do that these days is my critique is of the medical profession. We have largely considered back pain
Mm-hmm.
as a diagnosis, not as a symptom. And that's irresponsible.
Mm-hmm.
Back pain gets you in my door. You leave with a thorough understanding of where it's coming from. And
Sure.
if you come in my office and I say, yep, you got low back pain, we're going to throw a little heat here, we're going to throw a little ultrasound there, and I'm going to crack you here and stretch you there,
Mm-hmm.
I still haven't encapsulated the problem. So, I've raised the bar in the exercise profession by asking exercise professionals to screen before they exercise. But I've also made quite a few medical professionals uncomfortable and said, your diagnostic skills are not good. I don't wait for an MRI to tell me what's wrong with you. I wait for the MRI to confirm what I suspect. And that's a completely different operational standpoint. So number one,
Mm-hmm.
if you've got long-standing low back pain and your best efforts to exercise haven't resolved it, just involve a medical professional, but don't stop training. Just
Sure.
get their advice and get some sound advice. But secondly, don't exercise in the direction of pain. However, map out your dysfunctions and
Mm-hmm.
attack those vigorously if they're not complicated by pain.